All right, welcome back to the Ottawa studios of Inside My Canoe Head. I am your host, Dr. D. Today, we're going to do a bit of reflections on preparedness, the goals, and why this thing is so freaking important to how we run our lives. So sit back, grab yourself your favorite beverage. Let's get at her. All right, thanks again for joining us here at Inside My Canoe Head and all of your feedback that keeps coming back into us at www.insidemycanoehead.ca because we're great Canucks. We appreciate all your feedback, good, bad, or indifferent. Keep it coming. Got a suggestion for an episode? Throw it our way. This is our reflections episode. I wrote something on LinkedIn this morning, and it really just said to myself, we never have the tough conversation, right? The unpopular one that doesn't go well at parties. You always know that person. They're right, but you're cringing because they're saying it out loud, right? We have this cultural theme that we just don't say the unpopular stuff out loud. Everybody knows it. Everybody in the room understands it. They get it. They probably even prescribe to it, but they just know that, you just generally don't say this stuff out loud. Well, guess what? I'm not that guy, right? Unapologetically clear, and here I am. I wrote something this morning as an article that I was reading from The Hill. Now, The Hill is a U.S. publication based upon, Congress and The Hill. And it's basically, it came out in March of 2021. So after the significant winter wave of COVID-19, and it was about, are we ready for the next pandemic? And this was written by a couple of notable doctors, and they wrote it from the perspective of the healthcare system is barely able to manage the way it's set up now. The lessons that they took away from the pandemic was the surge in patients showing up almost made it broke. And because of the way the U.S. healthcare system is, and that corporations run, for-profit corporations run hospitals, it almost put them to the breaking point where the hospitals themselves needed economic bailout from the federal government. And because the surge capacity that these doctors ascribed to a future capability didn't exist, a lot of the normal ongoing operations of healthcare had to be suspended. So, your oncology, your cancer treatments, and other treatments like that had to be paused so that personnel could deal with the pandemic patients, which put an increased risk and increased death rate for people that were suffering considerable major diseases. And elective surgeries just went out the right field fence, right? Those were just generally not happening. Their answer to it was a set of national security hospitals, national preparedness, national public health hospitals, and significant extra investments in it. If you've listened to me even for the slightest, I'm an economic realist. I would love to have an unending penny bank of money to give to all kinds of these things that we think are important in society. But remember, every penny the government hands out to anything, whether it be a corporation, a program, or a transfer to an individual, first has to be drawn from one of three sources. It has to be drawn from the individuals as taxation or fees. It has to be drawn from a corporation as taxation, which, by the way, the people pay that in prices. So corporate taxes are taxes on the individual. There's no separation there. And the last one is the next generation. So you're borrowing from the grandkids. Most of them aren't even born yet, and you're saddling them with debt. So every time you call for an extra investment, it's logical for those that may not hold the same viewpoint to say to you, hey, listen, it's great. You think we need, $3 billion more investment. And I'm going to pull that number out of the air. It's not in the article, so I'm just making this up. But say you call for a $3 billion investment in national preparedness for the next pandemic. My response to you is, I don't have anything to say that $3 billion is not the right number. What I do know is that the capacity to generate more revenue is dead and actually is falling because of the state of the economy, and the taxpayers are broke. So my question to you is, if you're going to call for $3 billion in funding, where would you like that to come from? Because the government has to get it from somewhere. Are you saying we believe that it's appropriate to add $3 billion in extra taxes to the individual working American to fund this, right? And you can say the same thing in Canada. And it's not that we're us economic realists, as I call us. I'm a libertarian. I've been clear about that. So I believe government should probably be about 1/10 the size that it is right now. That's just my political views, whatever. Everybody has them. Everybody has a frame. People who say they're agnostic are just not telling you exactly what their feelings are. But even if we don't make any considerable cuts like that, is it not an honest question to ask? Is it not an honest question to say, hey, listen, you're asking for all this additional funding for a very good cause. You may even have a very well-structured proposal that has a clear delineation where all of this funding is going to, right? Now, traditionally in the world, it's not healthcare's responsibility to find a funding source. It's healthcare's responsibility to advocate for what they believe needs to be done in their sector to reach an outcome that they believe is good for society, right? And so the government gets these inputs from every sector, right? Everybody wants more money. Everybody wants more investment. They don't want to say, I want you to raise taxes on people. They'll use keywords like strategic incentives, or we need to make long-term systemic investments in this program, because nobody wants to use the language of we need more taxes on people to give me more money, or to say, in the United States of America, it's totally unpopular to say I need to take 10% of the defense budget and reallocate it to healthcare, right? That would change the whole conversation altogether. So I know it's not the responsibility to advocate. The reality of the world we live in, and I've said this clearly in Canada, and I'll use Ontario as an example. They recently started Ontario Core, Preparedness grants. So on the surface, the government of Ontario is making overt investments at the subnational level to increase preparedness in the population. Compare that to the billions of dollars, and I mean, I'm using a B, that they gave to 2 or 3 electrical vehicle battery plants that are only going to employ 2,000 to 3,000 people, period, full stop, in the entire province. The preparedness grants and the preparedness funding for Ontario Core are absolutely dwarfed by the investments in these EV battery plants. So we know that governments may say that preparedness and healthcare is an important, and public health and preparedness are important preventative measures that we need to take in society, and they give these token investments. That's the reality. I use Ontario because the numbers are the proof in the pudding. You can translate that to any subnational government, I'm going to argue, anywhere across North America and anywhere around the world, and even at the national level. There will be token transformative transformative light investments in preparedness, but not at the level that people are calling for. And so my advocacy has always been, we live in an economic reality. So when I think about reflections on what we've tried to do this year, we are still not having the conversation about we live in this framework. So if our total preparedness budget for the province of Ontario sits at around $1.2 billion, when you bring it all in, the total role of emergency management and everything, say it's $1.2 billion. We're not getting any more money. Okay, that's fine. Welcome to the world of fiscal reality. There isn't any more money. And oh, by the way, healthcare and education at the subnational level will win at the cabinet table 10 times out of 10. So my point to the emergency management professionals and to the bureaucrats working within the public safety forum is there a different way to allocate that $1.2 billion that might reach a better outcome? It's not about doing more with less or doing more with the same. It's about not changing anything, because you don't blow the house up until you've got a new house to live in, right? You don't burn down the old house until you got a new one to live in. What you need to do very, very clearly is to be able to articulate that we've gone through the machinations. We've brought a lot of really intelligent people together. We've thrown Jell-O all over the room, and we've thrown spaghetti against the walls, and we come up with something different. And I've talked about this in a podcast before, and I've written about it on my Substack. Jump over to Substack. It's at Jeff Donaldson or at Preparedness Labs. If you look at Substack, I'd love you to subscribe over there. It's free of charge, as is your favorite podcast, Inside My Canoe Head. I've talked about it with my graduate students at being the 150 challenge. And the 150 challenge is, if I told you you had 150 FTEs, which are full-time equivalents, so human beings, and I give you an allocated budget equivalent to what the subnational budget is here in Ontario for preparedness, and I'm like, build a structure. You're a professional working in the field. You're in a graduate education in disaster and emergency management, which means you're a thinker. You're somebody who has the capacity to think differently than the system does. If I said all the system and regulatory environment were thrown dans la poubelle, as we say en français, if we threw it all in the garbage, and I said to these people, your service delivery requirements don't change. You're not allowed, you must, whatever you construct must deliver this service. But if I was to told you it would be wide open, the sandbox in which you can play and construct it, how would you do it? And every time I've run this scenario, which is 2, I mean, it's not a massive number, but every outcome that we've done with students, we've come up with a whole innovative series of doing things. Not once did a student tinker with what existed. So incremental changes, marginal changes, slight changes in regulatory environments, slight changes in regulatory frameworks. No, every one of them blew it up and reconstructed the entire frame of emergency management within the province of Ontario to reflect a totally new way of doing business. And of course, we didn't run we can't run any experiments on it. So I can't sit here and tell you they proved they could do it. But they came up with a whole bunch of solutions that on paper and from a first principles viewpoint likely are going to lead to better, and in 2 rare cases, significantly better delivery of services to the people of Ontario without any additional funding, right? Just within the funding, just within the people we have near. It's not about firing people. This isn't a Doge requirement as you have in the United States. It's just about reflecting, saying the fiscal reality that public health and emergency preparedness live in is that there is no more money coming, right? It's just the reality. We all love this, the 8-to-1 to 16-to-1 odds that everybody talks about money in mitigation. You're not wrong. But nobody's listening and they're not going to listen. So the point is, what do we do with the money we have? How do we construct something that delivers the services because we're mandated and legally required to deliver a level of service? But if I was to throw out the rules and tell you how to construct it as a professional that works in the field, not some outside dude like me coming in and telling you how to do your job. No. Giving you the freedom to reconstruct it, it wouldn't look like the same. And what I wrote about this morning, and this is the unpopular truth, we have a sick, unhealthy population, right? We're consistently trying to spend more money on healthcare, to have more treatment options, to have more beds available, more doctors available, expanded healthcare needs, but nobody's trying to fix the patient. Everybody's trying to treat the symptoms. The expansion of the unhealthy public is exponential. Just look at the stats on diseases and a whole bunch of other things that exist in the United States of America, across Canada, and a number of other Western nations. The frequency and severity of disease is increasing in the population. The population is unhealthy. All that we're trying to do is build out capacity to chase the exponential growth of an unhealthy population. That is a death spiral to economic collapse. Both of those systems are going down. Both our personal and our physical and mental health as a society is crashing, and our ability to deal with the growth in problems are crashing. And if all we're going to do is continue to call for more and more investments in ongoing additional hospital beds and additional healthcare, and nobody's going to have the unpopular discussion about looking at the actual health of our population, then we will always be short of money. We will always fail to deliver a level of service, and we will never, ever in any situation, even if the U.S. Defense Department didn't exist, you would never have enough money in the federal coffers to provide health care if you continually let the patient get sicker, right? It's like those, you see many documentaries on Netflix and places like that about sicko and the sick population, right? A sick population is very good for business. And in some countries, healthcare is an industry. It's a for-profit industry. So it's only successful when you have a sick population. And we are, as a society, we're doing an exceptionally great job of creating this massively unhealthy and sick population that are demanding ever and ever increased access to healthcare, mental health care, physical health care, and a whole bunch of other problems with it, which leads into preparedness, right? Because I've said from the get-go, I've done over a decade of education and research directly into emergency preparedness for individuals. There are three things that are key, that are the three biggest things you can address for yourself to be prepared, right? Beyond meeting your neighbor, which your community is always your number one resource. So we take resources off the table. It's your physical, your mental, and your financial health. Full stop. You, looking that incredible person in the mirror. When you're physically healthy, you're mentally healthy, and you're financially healthy, you have the ability to navigate significant disruptions without placing demands on the public system. But when you're physically unhealthy and you're mentally stressed to the nines and you're broke AF, and then something occurs, you're going to need significant public sector investment, which means the cost is going to go exponential. That number is true. We can lay it out for you in any manner and respects. So the point is that if we actually want to reduce the cost of healthcare, not reduce the rate of growth of healthcare, but reduce the demand to healthcare so that, as the article in The Hill says, we have excess capacity, excess beds, surge capacity, and great stockpiles of healthcare equipment to deal with the next pandemic. Imagine a world where the majority of hospital waiting rooms were empty. Every hospital had open beds for patients. Surgery wait times were maybe a week or two in publicly funded systems, because we made the conscious choice as a society to create healthy humans. And when the human is healthy, both mentally and physically and financially, guess what happens? They don't have regular demands on healthcare. So when diseases like cancer happens, tons of capacity. When tragic traumatic event happens, the ambulances are there in a heartbeat, into the emergency room. The teams are waiting, do the surgery right away, and there's definitely a bed for these people, including, lots of untapped ICU beds with great staff waiting. That's a world we can have. But my argument to you today is there is no methodology you get there by additional funding without making the patient healthy. If all you're doing is calling for more money in any sector, and this is true in emergency management, it's true in mitigation, it's true in healthcare. If all you're trying to do is get more money to treat a symptom, but you're not willing to address the uncomfortable conversation in the room about the unhealthy patient and fix the patient, not the symptoms, then you're never going to have enough money. You're never going to be able to tax people. And when you reach the point at where people are taxed out, which in the US and Canada, where 87% of this podcast is downloaded, you have deficit financing on both sides. That means that the finance departments of both those countries have realized the capacity of the individual to hand out taxes has been tapped out. Like there's no more. But you have this egregious desire for more and more spending. So the only thing a country can do is go to deficit financing because the taxpayer has no more money, right? You can't raise it in fees. Every penny you charge in corporate taxes, it's basic economics 101. And sometimes I'm surprised that people don't get this. They raise corporate income tax rates, right? That's great. Raise them as high as you want, because all that the corporation does is they pass every single additional charge on to the people. There is no world where you just simply take part of a company's profits and that their price stays stable, right? That world doesn't exist. It can't work. It is illogical. And it's a fallacy. Like, you can't have that. You can't say we're going to take 50% of the corporate profits away, but we expect corporations to keep their prices the way they are. The answer to that is no. Every additional charge you give a corporation in any fee schedule, whether that be taxation, regulatory environment, or administrative costs for being part of a system, every single one of those, including the personnel cost to administer the regulatory environment you put them in, is passed on to the end consumer in prices, which means it's a form of tax on the individual. So there's really only one source of money in any civilization, and that is the individual's labor. That's it. Everything comes from the individual's labor and what they earn. And so my argument today, and this is part of why I found that Hill piece so important to reshare, is simply because we don't want to fix the problem. We want to address the symptoms. Now, that's an unhealthy population in this case that I bring up today, but we can move that conversation to the world of preparedness and have the very same set of deliberations, right? Everybody calls for more money in preparedness. I don't think we need to invest any more money in preparedness. And I think preparedness levels are atrocious. I said, and it's clear because I think, and based upon my decade plus of research in this one specific, very little niche, that the money is all being spent in the wrong place. And you're asking people to do the wrong things. They're not paying attention anyhow, because your communication strategy is absolute junk, right? But we don't need more money in preparedness. We don't. We don't need any more money in preparedness. What we need is a program designed to get the end result that we want, which is a better prepared population, which a complete preparedness communication program that we have right now is not correlated to any better post-event outcomes. And even if everybody in the entire population followed exactly what the government told them to do, my argument to you, based upon my research, is that the population wouldn't be any better off. You wouldn't have a more prepared population if they followed absolutely everything that the government said. It's just the two are just not correlated. And that's the problem we have. We're not addressing what we know. And this isn't just Jeff, Dr. D banging off on his head here. This is what the evidence shows us. We know the steps that people have to take to become more prepared that lead to better post-event outcomes. We know those steps don't cost any money, right? They don't. They don't cost. And the cost to the government to make them happen is actually less than what they're spending now on the current program. So I'm not calling for reductions, but you could actually reduce the amount of preparedness education spending that you're doing now and get exponentially greater results if you actually focused on what led to better post-event outcomes, right? But we don't. Fair enough. That's a call. They make it. I've written extensively about it. I wrote a 200 and some page dissertation on it. I know the power of social capital and the power of human relationships. I advocate, I lecture on it in my courses, and I travel on a speaker series around Canada, and hopefully I get an opportunity to speak in the U.S. soon to talk about how we can have transformational change in preparedness education and raising the preparedness levels of the population. But guess what? It doesn't cost any money, and that's the part people don't like, because everybody loves the train, getting aboard the train of more money. And this is a slight side example, but this is a brilliant question. We had up here in Canada, for my American friends, your incoming president is being quite formal about his threat of tariffs, right? Which is fair enough. He's the president of the United States, or soon to be. He can say whatever he wants. And we realize that he's probably serious. So all of a sudden, out of the blue, the government found $1.2 billion or something like that to invest in border security, right? Because we realize that fentanyl and illegal aliens are probably something we should address, right? And it just takes a Donald Trump to tell us to do that. But I think that's embarrassing enough all on its own. The point being is that we don't have any money. Like, we're already $60+ billion deficits, which is egregiously unhealthy and immoral level of spending from a government. But whatever. Just throw a couple another billion at it, and they put it out there. And the hilarious part is there's no evidence that anything they're going to do is actually going to make a difference, right? There's no evidence. They're buying a bunch of helicopters. And drones. This is the funny part, right? This is the part that makes me laugh. The border between the U.S. and Canada is some 6,000 kilometers long. Just think about that. And you're going to buy 4 or 5 new helicopters and a dozen drones. Like, seriously. Like, what? That's the same as giving the middle finger to our neighbors to the south. And you wonder how the big fella is going to respond to that, right? But what nobody's doing is saying, hey, listen, we've got a common border. We don't share the border with anybody else, right? Both parties are now realizing we probably should make that a robust, secure border. Why don't we have a combined border strategy? Why don't we work together? Because we don't need more money. We need better cooperation, right? We need robust rules that make it dumb as hell to cross that border in either direction. Without authority, because you can get your arse handed back and you're never allowed into the other country. You start making simple rules, simple policy regulatory rules between Canada and the United States, and you figure it out, right? You just figure it out. You don't need more money. You need better cooperation between people. But the best part of this question was, as a reporter asked the presumptive next Prime Minister of Canada, the leader of our Conservative Party, because their current government is awash in the polls and will get creamed at the next election, said, the government said $1.2 billion. Do you think that's sufficient? And he turned around and, set aside his one-sider shot at the CBC reporter. But his point was, we're making a mistake because we keep measuring success in the volume of money we throw at it, right? Because if 1.3, he would have said, what they were hoping he would say, no, I'm going to invest $2.7 billion, right? As if more money is equated to better outcomes. And his whole point was, why don't we measure success by reduce fentanyl and reduce human trafficking across the Canadian-U.S. border? Why don't that be the measurement? Why does it have to be a number? Why is a larger number more successful? And he used a number of examples. Like, we have a government who brought in a whole bunch of rules about strengthening gun laws. I don't care what you think about it. They hired a massive amount of bureaucrats to akin, I think it's over $100 million now, and not one firearm has been taken off the market. But they've spent $100 million in salaries and bonuses and staffing and office costs, etc., right? We don't have that $100 million. And that $100 million reached zero results. And this is the problem we're having. We just have adopted a mentality in our system that somehow more money is equated to better outcomes. If we just made investments in, we would do better, right? Hilarious, because there's no evidence to show that's true. Right? There's no evidence to show that if I threw $100 million extra at New York State's emergency preparedness budget, that the people of New York would become more prepared. There's no evidence to support that. That if you just took the current program and put it on steroids, again, because I'll argue with anybody that the program is totally orientated in the wrong direction, that you wouldn't get it. We're on this addict of addiction to, we just need more money. If people would just give my cause more and more money, instead of doing some internal reflections and saying, hey, I am fortunate enough, I've been given a task, and I'm fortunate enough to be allocated this resources. Let's do a bit of an exercise and try to figure out, maybe there's a different, not better. I don't used to like the word better, because if you say there's a better way to do it, that says we're doing it wrong now. Maybe there's a different way to allocate the resources we have. And this is why I base that 150 challenge that I do with my students. It's an arbitrary number. I don't care what number you pick. And imagine doing it with your teams. So say you are the, whatever county in the United States of America or a county in Canada, and you have 7 people in emergency management office, and you have a $1 million budget. Okay. And you've been given a list of tasks. You're currently organized in a certain way, and you expend money a certain way based upon a system you didn't create, you just moved into. But if I told you, if I gave you 7 FTEs and $1 million, and all you had to do was deliver these outcomes, but you could structure it in any way that you thought, I'm going to argue with you today that you will have some brilliant ideas that will come out of all of the people that work for you, because they'll have the freedom to say, ICS is current structured in this way. We're going to throw that dans la poubelle and we're going to do something different. We've currently structured it in a relationship, municipality to region, region to state, state to national. We're going to throw that all in the garbage and we're going to restructure it in a different way. We're not saying burn the house down. We're saying look at your different new houses you could build for the same amount of money and see if one of them is much more efficient and effective in delivering it. Then create that house, build it, and then burn the other one down. That's all we're saying. Listen, reflections sometimes are really important. And sometimes what we need to do is have those difficult conversations and say the quiet part out loud, right? Our healthcare system is crashing and it will continue to crash. And at this pace, it will collapse on us because the population is unhealthy. It has nothing to do with the amount of funding. That's the unpopular opinion that people won't say out loud. I don't care how much money you throw at it, unless you make the population healthy, unless you put them on the road to healthy, you're done. It's a waste of money. Same thing in preparedness. If you just keep throwing money at the current crap that's being done right now, I don't care if you 10x it, you're not going to 1x the entire preparedness level of the population. It's hilariously bad. Anyhow, I hope you enjoy this, and I hope the reflections such as this are interesting, and say the quiet part out loud. I have no problem doing it. I have the platform. We thank you very much for listening to us here at Inside My Canoe Head. Drop over to our website, www.insidemycanoehead.ca. Great Canucks. Everything is that you need is there. There's a place to buy us a Christmas present. Go ahead and buy us 1 cup of black coffee, $5 through the Buy Me a Coffee link. It's fantastic company of amazing people. I can't say enough about the wizards who came up with Buy Me a Coffee, right? It's just a simple way to say to somebody, hey, I don't want to buy a subscription, all this other stuff. I don't want to pay for your Substack articles, that crap, but I just think you do a really good job. So here's a cup of coffee. Right? Enjoy your $5 cup of coffee. It's just a way to thumbs up. I've had people buy me 10 before in the past. I had a supporter in Germany, wonderful lady, come out and say, we appreciate what you do. Here's 10 cups of coffee. It's just what us creators love. Feedback. In any way, we will always have a YouTube channel, Substack, and this podcast free of charge, getting our ideas out there to the public. Free of charge for you, in service of preparedness and building a resilient life, chasing your dreams, and rocking an incredible existence on this planet. Take care and stay safe.